Dear Chairman, dear colleagues and friends in Pakistan, it's a great honor for me to be part of the opening ceremony of the first course about sexual and reproductive health in Pakistan. I'm Peter Schwarz. I'm president of the International Diabetes Federation, and it's especially a great honor for me to talk about here because three organizations who are member organizations of the International Diabetes Federation are part of the development of this course. Furthermore, there are more organizations being organizing this first course about this, let's call it also sensitive topic in medicine. And now everyone might think it's a sensitive topic because it's Pakistan, because of your cultural environment. But this is only partially true. Also talking in Germany, anywhere in the world about this topic, it's sensitive because often the patient fears to talk about this, but also we as healthcare professionals, we fear to touch this topic. Every year I'm training 150 new diabetologists in Germany, and I always include lectures about sexual and reproductive health. And for many of the colleagues, and some of them have 10, 15 years experience in medicine, in treating patients, it's the first time to discuss this topic. So I actually would say congratulations to Professor Zaman Shaikh, who is the course director, and Dr. Sheila Nazim, who is the co-director of the course, that you have organized this course. Congratulations to all the organizations like Diabetes Association of Pakistan, Primary Care Diabetes in the Primary Care Diabetes Association, and also the Endocrine Society in Pakistan, that you have co-organized this course addressing this important topic because it's part of our health. It's very important for our patients and ourselves. And it is a big part, very important part about quality of life. But we are scientists. If we go deeper into this topic, what is the conjunction between, for example, diabetes and sexual and reproductive health? There is a significantly increased risk of sexual dysfunction in people living with diabetes. It is the same for people with type 1 diabetes, but it's actually significantly higher also in those with type 2 diabetes, and it's affecting more than 70 or 80% of people, and it doesn't matter, is it a female or is it a man? It conveys issues like reduced libido, erectile dysfunction in men, and decreased sexual desire and satisfaction in women. And even more, there are common sexual problems like erectile dysfunction, ejaculatory dysfunction, reduced libido, and hypogonadism in people having, especially men having diabetes. In women, it's more vaginal distress, lower libido, pain during sexual intercourse, and orgasmic disorder, and other aspects related to neuropathy and also vasculopathy related to diabetes. But it will not finish there. Also, the whole hormonal aspect of sexual dysfunction, reproductive health, pregnancy complication, infections and complications in people living with diabetes, which are directly or indirectly related to sexual dysfunction. If we look into broader health and care implication, it is a topic which is neglected, let me say it like this, in our healthcare system. Yeah? As I said at the beginning, we often fear to ask the patient about it because it's also sensitive for us. And our patients are fearing also to ask this, or they don't talk about this. And this is a point where we should be the frontier and we should be proactive in a sensitive way to touch this topic. Because what we, and this are now German and European experience, what is our experience? If you start talking about this, often it's like a relief for the patient that they say, oh, you are the first one asking me this. You are the first one telling me that this is important and this is part of my health. And finally, of course, there are many psychological factors related to sexual dysfunction and diabetes because it is of multifactorial nature. Talking about all this, you already see it is important that we are touching this. It is important that we integrate this into our approaches of healthcare. It is important because it addresses the need of our people living with diabetes, which of course, for me as the president of the International Diabetes Federation, is the primary topic. There are 890 million people living with diabetes worldwide. And what we should be driven from is addressing the need of those people living with diabetes. And this may vary everywhere in the world. It may relate to accessibility and availability of healthcare. It may be related to other aspects. But there is one thing in common, that sexual health, sexual and reproductive health is very common for any person living with diabetes worldwide. So it is important to start this course, but it is much more important to incorporate what you learn, what you discuss with your teachers into your daily diabetes care, into your daily endocrine care, into your daily health care for people living with chronic diseases or any other kind of disease. There's also one aspect where diabetes or diabetes treatment and sexual health and reproductive health has a positive or very positive aspect. You may know all the people, all the women having PCO syndrome, and often they try to become pregnant over years and years. And then you start treatment with metformin, and suddenly they get pregnant. So you see already, there is a lot to learn. There's a lot to do. But the most important thing for us is, in a sensitive way, talk to your patients about this, because they will be thankful that you maybe are the first person touching this topic. So I wish you a very, very good 6 months course. Challenge your teacher, discuss with your teacher, discuss with each other. Don't fear this topic, but especially don't neglect and don't fear to talk with your patients about it. It's a great honor for me to work with people like the coordinators of this course, like all the teachers in this course, because you are the frontier at the end to address the need of people living with a chronic disease. Thank you very much. Thank you very much for your commitment, your enthusiasm in this topic. Thank you very much for your action.